Hey, Allie, do you ever talk to women that are frustrated with their doctor visits because they feel like they're rushed, their doctor doesn't listen to them, doesn't spend any time with them?
Absolutely. That conversation comes up a lot in my studio. And I want to be careful that we don't blame the doctors because I think that can be the easy thing to do. And we're going to learn today why that is, why doctors don't have a lot of time, and about another option that's out there. Our guest today is Dr. Jennifer Evans from the Rejuvinant Family Health Care here in Macon, Georgia, who practices the model of direct primary care or something along the lines of a concierge type model.
Before we dive in, let's give a shout out to Miss Kelly Smith. Thanks for being a Girls Talk Healthy Aging listener. Let's
Let's
dive
dive in.
Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
I have so many questions for you, Dr. Evans. And one of the first ones is tell us, what is a direct primary care doctor versus a concierge style doctor? Let's just start there.
But yeah, that's a good place to start because some people have not heard of either. So with direct primary care, it's a relationship with the doctor, the provider, and the patient. There is not an insurance company that we bill. So patients can say, hey, I want you to be my doc. And you set up a periodic contract with agreement with that patient, and the patient pays you for your services. And it's not per visit like we're used to here. Every time we go to the doctor, we know that that's going to be a fee. But in direct care, a lot of times we try to include as much as we can into that monthly fee for our services, and the patient pays that, whether it's monthly, quarterly, whatever, and you just receive the care that you need in a timely fashion, regardless of how many times you need to be seen.
So 1 month you might not be seen, and the next month you might go 4 times. And
Right.
then you pay accordingly. Kind of like car insurance. Like you,
Exactly. Yeah.
whether you need it or not.
Whether you need it or not, you have it.
Yep.
And I've come across where I'm doing some deep digging with patients who haven't had that one-on-one time before. They're used to being rushed in and out of a doctor's visit with questions that aren't answered. So we'll take our time. We'll deep dive. We'll say, hey, we need to look at these labs. And then once we look at these labs, I want you to come back. We'll talk about some things that we can do together, whether it's nutrition wise, whether it's exercise wise, whether we need to do referrals. We can come back and talk face to face. We can do televisit type of thing. But we're not just confined to that patients in the U.S. copay. Like, I'm not paying 3 or 4 copays to see you 3 or 4 times in a month. They've already, paid their fee, and we're taking care of them. And that takes that stress off of a lot of people, that we can get down to business of your health and see what's going on without rushing and having those obstacles about fees.
You've done a different style. You've only been doing the direct care model for the last 4 years, I believe, Dr. Evans. And before that, you were doing, I guess, what I would consider the more traditional insurance model, I guess. Can you tell us your practice before, what that was like, and your patient time with patients and how that worked versus now?
Yeah, so previous to opening my practice, Rejuvinant Family Health Care, I am strictly employed physician. So a lot of physicians and nurse practitioners, physician assistants are employed by some health system, some entity. And that entity is in charge of saying how you do things a lot of times. And it became frustrating because I'm really a person that wants to get to the root of a problem. And a lot of times you can't get to the root of what's going on in 15-minute slots. Um, and you're, you know, bombarded with very high patient volumes. Um, and you just can't do everything that you know you can and would like to do for everyone of your patients, each and every patient that comes to see you. So that just really got aggravating for me. So I learned about this model even as a resident, and before that, even as a medical student, I started hearing of this model. And I just did my research. It took me several years, and then I finally was like, okay, I'm going to jump out there and we're going to do this thing.
That's gotta be scary because that is a model where you're relying more on getting patients to buy in to your, I guess, and then do they pay monthly? Like for you with your
Mhm.
patients, how does that, tell us how that works?
Yeah, sure. So what we do is we have a agreement, and most patients will pay month to month. If they want to do quarterly, we'll go out to the quarter. I do see some college students, so we can set them up on a semester-based payment plan. Hmm.
And with the way that you have them, as they basically have like a membership, it sounds like, to
Yes.
work with you, to come and see you. And so what types of things do patients come to you for? What
Okay.
types of things do you handle with your patients?
Well, I'll say number one thing that brings patients in the door, especially over the past year to 2 years, is weight loss. And I
Yeah,
know you
yeah,
ladies know a lot about that.
yes.
But that brings people in the door. But a lot of times we're dealing with and we're treating high blood pressure, high blood sugars for diabetes, and then a lot of joint issues. People with joint pain and things of that nature, thyroid issues, and then people who just generally are concerned about their wellness and want to make sure everything looks good and is fine. I've kind of branched off a little bit. I'm helping people with some like laser hair removal, some hair restoration now, just things of that nature, because I like people to just feel good and just be well all around. So that's what brings them in.
Would you say that people tend to be more proactive or reactive in hiring you as a doctor?
A little bit of both. Patients who have heard of direct primary care before tend to be proactive. Like, hey, I'm moving to town. I had a direct care doctor in my previous city. I found you. I want to get established for when I need care. And then there are people who have had, health issues come up. They've been trying to figure out how to pay for care or just need somebody to spend that time with them. Um, and they're calling us and we're getting them in quickly.
And if I have a pre existing condition, would my monthly fee be similar to someone that's coming in proactively that has no pre existing condition? You know how health insurance is? So I'm kind of
Mhm.
wondering how that works with this sort of system.
Yeah. So mostly everybody is going to get the same monthly rate, same monthly fee. There are levels and tiers to some people, some practices, the way they practice their care. Even for children, their fees are in different levels and tiers, just kind of based off of okay, in this age group, these patients usually need X, Y, and Z. You think about your tiny babies; they need more exams. They're seen more often. They need more vaccinations. Those type of things. So in a pediatric practice, a lot of times the younger the patient is, the fee might be a little bit more, just to kind of cover everything.
Mhm.
And then as we age and we think about adulthood and things, some practices for older patients, people that may have more issues in those age ranges, the price might go up as you age.
We're going to interrupt this interview for just a second because we've got something we want to make sure that you know.
If you're struggling with your health, with your fitness, if you don't know where to start or you know what to do and you're not doing it, we're here for you.
And all you need to do to get our help is to reach out to Shawna and I at our email, sapodcast23@gmail.com. And we're happy to help and we will be in touch. Now back to the show.
And maybe I missed it, but I think you talked more specifically about direct primary care, but do we talk about concierge care, or is that the same thing?
It is different.
Okay.
In direct primary care and in direct primary care, there's some specialists as well that call themselves direct specialty care. So we'll say direct care. We, in that model, do not bill insurance. And that's the distinction that we make from concierge. Some concierge docs will still bill insurance for certain fees that are covered by insurance. And what you're paying the concierge doc is things that are above and beyond that your insurance may not cover. And just to have that peace of mind that you call that doc, they're going to be there for you. And that's what's similar between the two, is that we have time with our patients. What's different is how we're getting paid.
So you don't file insurance. If I come to you and I say, I want you to be my direct care provider, but if I go to someone who's a concierge, are they going to bill me like a monthly fee? And then I don't really know what they're getting from my insurance. That's just kind of on their side. Or are they billing me the difference between what my insurance pays and what the cost is?
Right. I see what you're saying. No, they just have their fee. It may be like an annual fee, and like, hey, on top of what we do for your, that can be billed through your insurance, these are the extras that we can do for you to make sure that we have that doctor-patient relationship.
And so you do primary care. I'm thinking as far as how this model would work for, say, an orthopedic doctor, or especially the concierge type. I'm not going to pay a month, and I'm not thinking I'm going to have a joint issue on the regular and need to go see an orthopedic doctor. But primary care, that is something we all are doing hopefully are doing on the regular. So can you speak to that about what type of doctors utilize these models? And then you also mentioned some direct specialty care. So different types of doctors that this type of model works for. And then also what type of doctors would this model not be a fit for?
Right. Well, like you said, like with direct primary care, your primary care doc, you have that relationship. You want to build that relationship. That's who you mainly see it with. Primary care doctors, your family medicine doctors, your internal medicine doctors, your general medicine. But there are some doctors who are specialists that have found this model to be useful. There are endocrinologists in the state of Georgia and across the U.S. that use this model, ophthalmologists, surgeons, things of, I can kind of go on, but just depending on their resources and in their area, you can get creative with it, whether it's, hey, you have this surgery, I'm going to follow you for 6 months to a year. Your fee includes your surgery plus, your follow-ups and visits that we have, type of thing. There are actually, I believe it's in Oklahoma, a surgery center that is geared towards patients who are self-pay, and some of those docs utilize that center, utilize direct specialty care. It is harder to do on the specialty side, but doctors are getting creative with how they can see those patients. Um, for people who have maybe a long-term illness, whether it's rheumatoid arthritis, some type of autoimmune issue, thyroid, or some type of endocrine issue, where they're being monitored on a frequent basis, those specialists are able to help them in that model if they're seeing a specialist for those things.
So generally, if you're being proactive about your health, you're probably going to see someone that practices general medicine.
Right.
And then if it turns out that you have some sort of issue, would you pass that patient on to, say, an endocrinologist that might be able to offer deeper or more specialized service, if that's the case?
That is possible, especially with telemedicine. That is possible. What I have found, if that is not a option for a patient, a lot of times they do have, I would say, like we were talking about car insurance earlier, they have some health insurance to take care of those major things. So
Double dip. You can do both. You can
do both because we're not a insurance. So
right.
So if a patient, let's just say they come see me, we're doing their wellness visits, we are keeping an eye on a couple of things, and we're doing sick visits, cold, cough, injury type things in between. That's like going to get your oil changed, and if your check engine light comes on, we take care of that. And say you get in a car accident, then you're calling your insurance company like, hey, I got rear-ended, I was in this car accident, I had this issue happen. That's us sending you to the specialist to then use your insurance. Right. God forbid you need the hospital or anything like that, but we encourage people to have some type of coverage for those unexpected things.
That makes sense. Yeah. I mean, it's all very different as a Canadian. And so it's just very interesting to get some perspective on options in the US, because there are some models. A colleague of mine is a nurse practitioner, and she runs a similar style service for hormone therapy, that sort of thing. So it is coming to Canada in like pockets, but I'm not sure if there's general medical doctors doing this. So yeah, it's interesting. What do you see happening in healthcare as more and more doctors choose this route?
We'll talk pros and cons. Pros, you will have patients, populations who are better cared for because they're getting valued care, meaning that they are valued, and someone is able to take the time and really dig into what's going on and know and understand the full story. One of the cons could be that we're not seeing large volumes of patients because of the amount of time that we spend with our patients. So a lot of times direct care practices will have fewer patient panels, like the number of patients that they're willing to take on. So then that becomes an issue with access. But if we're able to create systems of people that are working together, I think it will still be beneficial. But you will see a lot of doctors and providers turning to direct care because they're able to do what they planned to do in the first place with their career, with their mission being to, care for people, help them get better, help them stay well, you know. But you'll see more people as they get into that, and that's why they choose it, is because they can really and truly care for someone.
Yeah,
Yeah, I've seen that. I think that we get upset a lot of times at the doctors that are part of this system because they don't spend time with us, or that we have to go multiple times to just get one or two things done. We have to have several appointments with them to get something accomplished. And so it can be easy to get upset or blame. We don't know who to blame. So we can oftentimes blame the doctors that, like you said, had that mission of doing this, serving and helping people. But now they're in this system that with insurance that does make that more complicated. I was actually saw something posted online where this person is an orthopedic surgeon, and she was talking about that she hates that she has to see so many patients in a day and not be able to give them the time that they deserve. And then people in the comments say, well, why don't you just do concierge or direct, and because she's an orthopedic surgeon, she made the point of, well, people are not going to be keeping a membership with an orthopedic surgeon. They're not expecting that. So those are just things that we as patients don't think about, all the different things that are involved, and how, that doctor that we're upset with that only took 5 minutes or 15 minutes with us, that's unfortunately that because of that system, and that because of the number of patients they have to get seen in that day, they don't have other options. And other than, like, if they are in a special or in a general field, I would say, rather than a specialty field, that they could choose to do that. But like you said, that's got to be scary. Going out on your own, opening your own practice, you don't have that. If you're only doing direct care, or only doing concierge, and maybe you're getting some insurance money if you're doing one of those. It sounds like you do get insurance for certain patients. Is that right? You do file on, or you do Medicare?
Yes, Medicare. Mm-hmm.
Okay.
Yes. For the Medicare patients, we're able to file for them.
Mm-hmm.
But for the most part, like I said, there are some hybrid. We call hybrid. I would be considered hybrid because I do, file for Medicare patients. But many people will choose what we call the pure DPC, the straight up DPC practice, where that's all they're doing, and that is scary, and it's given me a wild appreciation for entrepreneurs and business owners, and that's who my patients are, because we understand each other in that, way. Like, hey, I'm out here trying to live the dream. Sometimes I got to hold my breath and hope I make it through. But other times, we're celebrating those wins together, kind of deal.
Well, and someone coming out of medical school is likely going to have a boatload of school fees, and so you've got to get out from under that. And then starting your own practice is expensive. So those people that get frustrated with their doctors that are using insurance, they're probably as frustrated as the patient with only being able to see the patient for 15 minutes, but maybe their hands are tied. So I can see how, there's frustration on both the doctor and patient side. And I think you said you were practicing 12 years before you were able to go on your own. Is that correct?
Yes, I've been practicing out of residency for about 12 years. So we'll say maybe about the 9 or 10-year point, I was like, okay, we're almost at 5 years, because I jumped the boat right around COVID in 2020. So that was another hold your breath moment. But
for sure, for all of us.
For everyone, right?
What a time to be an entrepreneur. Whoa,
Yes.
girl.
Yeah, right. Like, what? Right now? But that was the moment in 2020 that I was like, okay, if I'm going to do this, I'm going to figure out how to do this so I can serve people the way that I envisioned serving people when I was doing all my training and things of that nature. So before jumping into direct primary care, I was seeing patients 15 minutes. And it's like, well, you have a long list of things that we need to talk about. Let's do these two things today. Come back in 2 weeks. Let's tackle some more, and
Yeah.
that gets frustrating.
Yeah, it's a lot of doctor's appointments. I mean, I'm noticing this because I go to a traditional, and it's you have to oftentimes go multiple times to get one thing done, and you're seeing multiple different people. So you might see a nurse practitioner, you might see a PA, physician's assistant, and then you see the doctor for certain visits. And you tell, I mean, my belief is that's because they're be able to bill the insurance multiple times, and like you said, they only have so much time, so they need multiple visits to get those things accomplished. I thought it was more of an insurance, because they need to be able to get reimbursed. And so more visits allows them to get more reimbursements. But I didn't think about the thing about, I only have time to cover 2 of your 15 issues, Miss Jones. So you're going to have to come back next week.
Right. And it's just frustrating. It's frustrating. So then you go back the next week. Hopefully you'll see the same provider, but you may not. So then it's like, what do I have to recount? Like, how far back do I need to tell you so we're,
on the same page.
Start talking about the next, issue. So,
yeah. Who is this for as far as financially with direct primary care or the concierge? Who's taking advantage of these services and who's not able to?
Right. Anyone who is able to pay the fee. Most of the time with direct primary care, the fee is affordable for most people. So think of your phone bill or your cable bill. I can't speak for all practices of what their fees are, but most of the times the fees are within those ranges. Think of it as one of your small bills on a monthly basis. So many people of all levels of income will utilize direct primary care. Some places have a foundation, or they do something on the nonprofit side where there is a nonprofit who is willing to say, hey, I have this many people and I want to cover their care. And I want them to see you. If they'd like to see you, I'd like to cover their care kind of deal.
Do you have that set up right now, Dr. Evans?
I don't have it set up right now, but that is something that I want to figure out how to do.
So if we have any donors out there listening to a show that want to get involved in a nonprofit part of that, to
let me know.
Basically sponsor.
Yeah. And even just being a sponsor for someone. See that as part of my vision. And as we continue to work with direct primary care in this model, I see that happening.
Did I ask about labs and diagnostics? Would that be covered, or is that kind of the copay that you dig into your insurance for?
A lot of it is covered if it's in-house for my practice. Some practices may, say, hey, here's a small nominal fee. Or if we, let's say we do particular blood work that we can do in office. But if it's something that has to be sent out, a lot of times people can choose to use the insurance if they have insurance to do it that way. Or they can, if the doctor is set up to have a particular contract to have lower fees for labs. Many people will say, hey, I want to pay you to get my labs done. They'll do it that way to get the lower prices that are affordable. And it's like, I'm not going to discuss numbers, but patients are like blown away with the difference. And, I built this through my insurance. Because I have not met my deductible, so to speak, I owe this large amount of money. And then for those same labs, If I did them, and I paid for it to be done through my contract with different labs and things, it's mind blowing how much less that can be for a patient.
So I'm looking at some of the questions, and that was one of the things that people wanted to know about, because I posed this on Facebook, is about labs and what type of labs and tests do you do for yearly evaluations, age-related, how are results provided. Seems each practice has their basic physical roster of tests. Some physicians are more proactive now and looking at more individualized tests.
Mm-hmm.
So, can you speak to some of that? And let's see, it says, who will you see? Let's see, who will you see for your yearly appointment, and who will you see in between visits? Do you provide guidance on healthy lifestyle? Let's see, fees, are there fees for specialty care, special fees for labs outside perimeters? So those are just some of the that's a lot of different stuff, but I'm just reading this from a Facebook post.
No, that's fine. But yeah, I right now in my practice it's just me.
Mm-hmm.
As we grow, we'll add a what we call it, advanced practice practitioner, a nurse practitioner, a PA. Will work in unison together on our patient panels. But you will see me in my practice. A lot of people who are growing to the point that they do have PAs or nurse practitioners in their office, a lot of times they co-manage those patients. So it's not like one doesn't know what's going on. They all know those patients and what's going on. But whoever your provider is, usually in direct care, that's who you're going to see.
Yeah, and one of the comments that I got when I asked people about this is one of the things that people said is that they have their labs, like they get to sit down with the doctor, and actually the doctor explains the labs and goes in depth over those labs with them. And that's just one of the things that they like about that style of the and I posted as concierge, but I think that a lot of us don't know the difference. So I know I didn't.
Yeah. So I like to use the term concierge style. So because that concierge medicine is very beneficial. So a lot of people are more aware of concierge. So you for some people you're paying for 24/7 access to your doctor, point blank, period.
Yeah, I was at dinner this past weekend, and there was a lady there that has a concierge doctor, and then there was a guy there, and his doctor was changing over to concierge. And the lady that has the concierge doctor, that's what she says. She has the cell phone of the doctor, and she can call them anytime if she has something going on or something happens, or she's in another country and something is wrong, that she can just like literally call her doctor on the cell phone and say, "Hey, here's my situation. Help."
And do you have hospital privileges? So if one of your patients is in the car accident and they have a relationship with you, they would want to see you. So is that possible? How does that work?
Well, unfortunately, most docs, even if they're in the traditional system of we call fee for service, they're not going anymore. They're not going to the hospitals.
Yes, we have a hospitalist now in the U.S. most of the time, Shawna. So the hospitalist is that doctor at the hospital, and so that's who makes the rounds, not the actual doctor of that patient. Typically,
yeah. Well, the good news is, for my patients, I usually know when they're in the hospital because they are sending me messages like, "Hey," or they're giving me a phone call to let me know what's going on, or I've been the one to send them there. Like, "Hey, I think you need to go over, let them take a look at you, and if they say you need to be admitted, let's do that." And they're messaging me during their stay. I get a complete report about their hospital stay afterwards anyway, because I have a relationship with a particular hospitalist group. And when my patient is discharged, they're sending me a report.
Got it.
Yeah, similar to when I was in the hospital recently, I didn't see my doctor. Yeah, and they got a report. So, and I do the fee-based type thing. And I'm thinking about this, Shawna's making me think, like, this has been this is happening even before, and I don't know when this started. Dr. Evans, can you give us what timeline do you, like, you learned about this in medical school. So how long has this been a thing here in the States?
As far as like hospitalists,
As far as the direct primary care
direct
or the
care.
concierge style
Uh-huh.
services?
We're gonna say direct care started off. We used to call it like micro practice. Like I want a small practice. I don't want to have to see tons of patients to make a living and make ends meet. That movement, it was like late 90s into the 2000s, early 2000s, is what became direct primary care. So much
Yeah.
so that the American Association of Family Physicians, American Academy of Family Physicians, holds a meeting every year called the Direct Primary Care Summit. And hundreds of docs will come and either learn about how to set up the model and different things about the model to growing your practice, So it has really taken off. But I would say late 90s into 2000s, people were like, we're fed up. We're going back to what medicine was.
Yeah.
So,
But it's an entirely new skill set. You're trained in medicine, and now you're also an entrepreneur. So there's
exactly.
skills that you need to backfill to make
Oh,
that
yeah.
medicine practice successful, so that you get to spend the time that you want with your patients.
Yeah, oh yeah, yeah, and it is worth it. And for me, it's worth it. Sometimes you just got to get the coaching, the mentors you need to get your practice up and running as a private practice. But it's been so worth it.
Yeah,
And we're seeing this. I'm thinking, Shawna, just about how this is people's frustrations with lack of or being rushed through care has led to people going nutritionists or these or you have different types of doctors that maybe not people that go to, like, I go to a physical therapist that uses this model now, but I'm also thinking about people that have not been in medical school, that have been able to build businesses because they're willing to sit and listen and take time with people, whether it's a naturopath or whether it's a, whatever, nutritionist, you name it, especially in the health and fitness field. I think we've seen, and I think doctors on the flip side get frustrated that their patients are coming in and saying, well, I saw this online, or my nutritionist told me this. And they're like, well, that is not evidence-based. And they're like, well, that person spent 2 hours with me and listened to all my problems.
Exactly.
So
so there's all those people that are not as accredited, but because the patient gets listened to, the patient gives that practitioner a lot of credit for their
money.
You are so on point. Yes.
It's unfortunate. So your model is more favorable for science-based medicine.
You're getting that evidence-based, but you're also getting it where you can go and I can go pay Dr. Evans to spend time with me instead of going to someone who hasn't been in medical school and giving them my hard-earned money to sit and listen to my problems.
Right.
Exactly.
And my patients will come with like, okay, I looked this up. I searched this, me. I was like, most people are going to go as soon as they feel something or something's not quite right. They're going to go look it up. I like to give my patients good resources. If you're going to look, here are some good resources.
Yeah.
But they come with questions. And I say,
and you're able to educate patients because you're taking the time.
Yeah.
And if we're left with nobody educating us, we're going to go find answers somewhere, right? That's
correct.
Even if they're wrong answers, we're going to go find those answers.
Some kind of answer and something to try.
Especially when you know something's wrong with your body or things just aren't right, or you're just desperate. Like, you are desperate for answers, and you're going to find an answer somewhere.
Yeah, you're right. You are right.
Yeah. Now, if someone listens to this or needs to rethink their medical care, how would one go about vetting out this sort of doctor?
Right. You would vet out a direct primary care doctor just like you would choosing any other doc. Direct primary care does not mean that you don't keep up with all your necessary credentials and continuing education and things. But I would say if you're looking for a direct primary care doctor, look into what that practice's values are. Does it align with your values and things? Are they offering the services that you're looking for? You know, and then, just kind of seeing like, hey, just are they really willing to have an open and honest conversation with you?
Would you be able to set up a meet and greet? Because even if the clinic or the doctor on paper sounds like it's a good fit, if you don't feel comfortable talking to that person, it's not a good fit. So you can do a meet and greet.
Oh yes, I love meet and greets. We carve them out of our for our schedule. I think about how here, expecting moms might go kind of scope out pediatricians ahead of time to see where they're going to go. It's the same thing. I'll sit down. We'll have a quick chat about what you're looking for. I tell you what we offer. Maybe even have time to say, hey, well, I think when you choose a doctor, whether it's here or somewhere else, I think you need to make sure that you prioritize X, Y, and Z.
Right. So they leave, even if they don't choose you as a doctor, they leave with something valuable.
Right. Yes.
Yeah.
And what about if they do have insurance? Let's say that they have insurance and you're direct primary care, so you don't file insurance. So are they able to file their own insurance, or how would that work?
Yes. So what we do, we usually don't file any insurances whatsoever. But in the instance that a patient, now this is not for all offices and practitioners, but if it's something that they really need to have filed through their insurance, we can give them a form, the paperwork and things like that for them to take and to file it for that particular visit. It wouldn't be something that you would file like the entire fee per se over each month. Like you're not going to submit that to your insurance each month, so to speak.
So if you're coming in for a routine checkup yearly, that's not something you could, inside the model that you have, that wouldn't be something that you could submit to your insurance yourself, because it just doesn't fit. That model doesn't fit with the insurance model is what I'm guessing. Is that
exactly? Yes.
Okay.
Yes.
Okay.
Yes.
Yeah, they're not going to look at that code the same or whatever.
Right.
Because it's part of like a membership-based fee thing.
Yeah, it's membership-based fee. It does not fit like the coding and things. I still have the codes and things like that I use, especially if we're referring out, I'm ordering particular tests, we're sending them for imaging and things of that nature. We need the codes to communicate. But for everyday care, I'm not needing that for my direct care patients.
But some of their insurance might cover some of those tests that you're not doing in-house.
Right. So they have the insurance and they say, hey, even medications, like this is going to be a bit pricey, even if we, did discounts and things of that, got you discounts and things, it's still going to be pricey. You want to do this through your insurance.
Right. And so that's why you're encouraging everyone to have some medical insurance.
Yes, something.
Now, if you had a wish for our listeners today, what would it be, Dr. Nevins?
I would have a wish for the listeners to know that they are worth taking care of themselves. You don't have to be a quote unquote victim to the current healthcare system or feel like you're not being listened to and things like that. Outside of my model, there might be different alternatives and things. So my wish for the listeners would be that they know that, hey, I need care I should get care. I should not feel like I can't get it. You deserve care. You deserve to be taken care of.
Alli?
My wish, especially for ladies in our area, is that they know about Dr. Evans and that she's here in Macon. And her place is called Rejuvinant Health Care, and we'll have links in the show notes. And so we do have options right here, even though this is more popular in Atlanta and bigger cities, but we have this in Macon. So listeners, that's my wish. And if you're not in Macon, that you find out if this is available in your area.
Yeah, and you stole mine, as you often do, Alli, is that, yeah, I would wish that our listeners would find a caring doctor like you, Dr. Nevins, that can spend the time to listen, and that people know there are some options, and to be an advocate for themselves, to find the best option and doctor for them.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness.
And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback. If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.